1 in 7 hospital staff infected with COVID 19 after vaccination. Small study. People who get infected with COVID 19 even after getting a vaccine shot are known as breakthrough cases, implying that the infection has broken through the protection provided by the vaccine. A small scale study in healthcare workers at a private hospital in Delhi found that breakthrough infections occurred in 13.3% of them, about 1 in 7, with one requiring hospitalization. The study was conducted on healthcare workers from 40 Center of Excellence for Diabetes, Metabolic Disease and Endocrinology has been published in the journal Diabetics and Metabolic Syndrome, Clinical Research and Reviews. So, what are breakthrough cases? People who get infected with COVID 19 even after getting a vaccine shot are known as breakthrough cases, implying that infection has broken through the protection provided by the vaccine. According to the Union Ministry of Health and Family Welfare, the incidence of such cases in both vaccines in use in India, Covaxin and Covishield, has remained low. How was the study conducted? The hospital has 123 employees, but out of whom around 113 had been vaccinated by the time the study took place. The workers included doctors, nutritionists, nurses, paramedical workers, and maintenance staff. The healthcare facility caters to patients of diabetes with or without complications, related metabolic disorder, and those requiring non-emergency surgeries. A detailed database was maintained by the hospital regarding vaccinations and COVID 19 infections of all the employees from January till date. All infections after any dose of vaccinations were recorded. The study was conducted between January 16 till date. Of the 113 participants, 28 had been administered Covaxin, while 85 were inoculated with Covishield. So, what were the findings? Out of the 113 who had been vaccinated, a second dose was administered to 107. Breakthrough symptomatic COVID 19 infections more than 14 days after the second dose was seen in 15%, 13.3% of 113. All were symptomatic, with fever, and half of them had sore throat and cough. A few had loose motion and loss of smell and taste. Symptoms lasted from 3 to 14 days, except one who required hospitalization. All 14 persons with breakthrough infections had mild COVID 19 disease, said Dr. Anup Mishra, chairman of the healthcare facility. What are the implications? The researchers concluded that high prevalence of breakthrough infection is seen in the healthcare facility. Dr. Mishra said, COVID 19 infections after complete doses of vaccination will be important morbidity post pandemic and may become a source of further infections. We need more research and data, especially in community dwelling people. Breakthrough infections in India after complete vaccination should be prime area of research. This is an important area and clearly needs more research. It is reassuring that the majority of breakthrough infections seen in our facility are mild, but a significant area of concern is that asymptomatic infections were missed since RT-PCR test was selectively done in symptomatic patients. These asymptomatic patients are likely to promote viral spread. Thank you.